Hi, everyone. This is Dr. Ryan Shelton. I am with my go-to doc. Today, we are going to talk about an important comorbidity with long haul COVID. So, individuals that suffer from long haul COVID are more likely to be sensitive to mold and the mycotoxins released from mold. And unfortunately, many of the symptoms of mold toxicity and mycotoxin toxicity uh, mirror some of the symptoms of long haul COVID. So, we're talking about fatigue, brain fog, immune dysfunction, mood disorders like anxiety, depression, more susceptibility to environmental allergies. So, nasal congestion, cough, all of these, while they can accompany just long haul COVID patients, all of these can also indicate that you are sensitive to mold. Now, let me explain how that happens. So, when you get COVID or you're vaccinated against COVID and have a post vaccine injury from COVID vaccine, you shift the immune function. And that shift in the immune function, that shift towards a pro inflammatory state, opens the door. It opens the window to increase sensitivity to mold and mycotoxins. Now, generally speaking, when we think of mold, we think of something wet that's been damaged due to leaky pipes or a flooding issue. But did you know that about 50% of spaces, and that's both where we live and where we work, 50% of spaces, indoor spaces, have a mold problem? Half. And so you're going around your daily life, your normal routine, and you're around mold. Suddenly you get COVID, and now you're sensitive to that mold and the mycotoxins that the mold produces. It doesn't take much. It does take moisture, but it doesn't necessarily have to be a leaky pipe or a flood. So, air conditioning units often increase humidity. And if the humidity is above about 65%, mold can grow. And it may not be apparent. It may not be a black spot on the wall. Nonetheless, sheetrock and common building materials that we use in the United States are a breeding ground for mold. So it basically takes a little bit of moisture, mold spores to be present, and some kind of carbohydrate. And sheetrock is the carbohydrate that the mold feeds upon. And it's a vast problem. It's estimated that at as many as 10 million Americans suffer from mold toxicity and mycotoxin exposure. Now, why is this a bad thing? Well, it attacks mycotoxins, the poisons that mold produces, attacks the myelin sheath around nervous tissue. So, in the brain, in the spinal cord, any nervous system tissue in the body is surrounded by myelin sheath, and mycotoxins attack that, which means that the transduction, the transmission of neuronal signals are impaired. This can lead to brain fog, memory dysfunction, poor mood, depression, anxiety. We also know that mycotoxins attack directly the immune system. And so, in an already depleted state, suffering from long COVID, now you have a sensitivity to mycotoxins, a sensitivity to mold that further denigrates your immune system. It creates a toxic flood of pro inflammatory cytokines, and it also produces a lot of histamine. So, one of the body's natural responses, defenses against mycotoxins and mold toxicity is to produce histamine. And yes, you can get skin rashes and welts and bumps, but also histamine can affect you internally as well, uh, disrupting the immune system, disrupting the GI tract, so digestion is impaired, digestive enzymes decrease. You get a case of leaky gut in the intestines, and so histamine not only affects the skin, it affects the brain, it affects the gut, it affects the heart, it affects the blood pressure in the body. And a simple solution is to remediate, right? Eliminate the mold. And that's always the first step. Unfortunately, complete remediation of mold in your house or your work can cost thousands of dollars, and estimates are between $4,000 and $20,000 to completely eliminate the mold. Now, that's an important first step. Identify and eliminate the mold. And there are many companies that provide kits where you can place basically a petri dish in a room and collect the mold spores. It doesn't directly test for mycotoxins, um, which are the poisons that the mold spit off. But it does test for mold spores. And so you can have your house or workplace tested. And that's an important first step. Identify and eliminate the mold the best you can. Um, so, in addition to finding the mold and eliminating it from your home and workplace, there are things that you can do um, that help your body fight against mold and the effects of mycotoxin. One of the best treatments for treating mold toxicity and mycotoxins is glutathione. Now, glutathione is not well absorbed orally. There are some products that seem to be well absorbed orally, liposomal products. But glutathione is basically just three amino acids paired together. And when you take it orally, more times than not, your stomach just breaks it down into its uh, three individual amino acids, rearing the effectiveness basically void. So my favorite treatment of glutathione for mold toxicity is IV glutathione. I've seen it really be a game changer in hundreds and hundreds of patients suffering from mycotoxin and mold toxicity. And we're trying to create an antioxidant environment in the body because the mycotoxins are so pro-inflammatory, and the flood of cytokines and inflammatory markers just go through the roof. And one of the best antioxidants that the body can use to help fight off the effects of mycotoxins is IV glutathione. So I would highly recommend that. There are also binders that are important. So um, I I mentioned earlier that mycotoxins and mold toxicity directly affects GI health or digestive system health. Um, and one of the ways that it manifests is mycotoxins are reabsorbed. So, in individuals that are constipated, not having two or three good bowel movements a day, those mycotoxins hang out in the stool and they're reabsorbed into the system. And so, one of the more effective techniques that you can utilize if you're suffering from mold toxicity and mycotoxins are binders, taking binders. And some of my favorite are modified citrus pectin, bentonite clay, Saccharomyces. Saccharomyces is actually a probiotic, but it helps to bind mycotoxins so that you can eliminate it. So modified citrus pectin, bentonite clay, Saccharomyces, and I like the the green chlorella as well. It seems to be a very decent binder, and so implementing binders into your daily routine so that you're eliminating, you're binding the mycotoxins and then ensuring at least 2 or 3 bowel movements every day. You're eliminating those mycotoxins. Some people have also found benefit from taking activated charcoal as a supplement, as a binder. So do make sure that you're having regular bowel movements if you're taking these binders, because the point is to actually eliminate the mycotoxins from the body. Another very useful remedy for mycotoxins is high dose vitamin C. And most individuals will do well with IV vitamin C. And a great combination is glutathione with vitamin C as an IV. Most individuals, they have a bowel intolerance to high doses of vitamin C, capping at maybe 2 or 3 grams, 2 or 3 thousand milligrams of vitamin C. And really, what the intent of the vitamin C treatment is to push those levels as high as 10 grams or 15 grams, and you can get that through an IV pretty decently. There are some other supplements that have been found useful for treating mold toxicity and mycotoxins. One is an amino acid that actually helps the body produce glutathione, and that's NAC, or N-acetylcysteine. That can be purchased over the counter. A good dose of NAC is around 600 to 1200 milligrams a day. Yucca, that's YUCCA. It's an herb, and it has been studied for its ability to bind mycotoxins and help your body get rid of them. Vitamin D and vitamin K. Those are 2 supplements I always recommend individuals suffering from mycotoxins and mold toxicity. They help internally. Vitamin D and vitamin K. They help the liver to process the mycotoxins, and they're also good at preventing disruptions in barriers. So here I'm talking about the blood-brain barrier, the GI tract. So they help to heal and mend barriers. Vitamin D and vitamin K, I always recommend. A great food, high in sulfur, that studies have shown to help with mycotoxins and mold toxicity, are sprouts. So sprouts of all kind, broccoli sprouts, mung bean sprouts, any sprout helps the liver to detox mycotoxins and helps your body deal with mold toxicity. A couple of other herbs that have been useful in my practice in treating patients with mold toxicity: turmeric helps the liver process the mycotoxins, as well as resveratrol. Resveratrol is a powerful antioxidant. It does need to be taken at a somewhat high dose. I'm thinking of maybe 15 to 20 milligrams a day, but it's a fantastic antioxidant that helps to quiet down the immune system and help your body fight off mold toxicity. And I would be remiss without saying without mentioning the importance of taking a high quality, multi-strain probiotic, um, with the intent of trying to improve the microbiome. So these are the good bacteria that live in your digestive tract. And I would recommend taking, this number is going to sound high, but it is effective in my patients. I would recommend taking at least 50 billion organisms per day. And Yes, 50 billion organisms fits nicely in one capsule. Just make sure that it's a a high quality, viable, multi-strain. So yes, the lactobacillus, yes, the bifido, also Saccharomyces, as I mentioned earlier. Just because the mycotoxins do so much damage to the myelin sheath and nervous tissue, I put all of my patients with mold toxicity on phosphatidylcholine and phosphatidylserine. They help to restore some of the damage that occurs along the myelin sheath and can lead to a number of neurological symptoms. Um, if we look at where primarily the mycotoxins do the most damage in the body, it is without a doubt an organelle inside every cell in your body called the mitochondria. Now, the mitochondria typically is thought of the powerhouse of the cell. It's what produces energy within each and every cell in your body. So you can imagine. Let's think of a car and the accelerator, the gas that you put your foot on so the car can move forward. Well, taking damage to the mitochondria is like taking your foot off the gas. The car slows down, everything becomes sluggish. Hence, memory becomes affected, brain fog, energy levels, immune system dysfunction, mood disorders. Everything just slows down and is not operating at optimal levels. And so the mitochondria is directly affected by the mycotoxins that the mold produces. Now, if you look at mitochondria, we know that muscle has a lot of mitochondria in the cells. Roughly about in muscle cells, roughly about 1,000 mitochondria per cell. So muscles need a lot of energy to work. And when you take that energy away by exposing it to mycotoxins, that's a problem. That's where fatigue sets in. The liver has about 2,000 mitochondria per cell. Now that's important because your liver is the primary detoxification organ in the body. And so the rest of the body is continued to be assaulted by mycotoxins, and your liver cannot process them as effectively. Now, the tissue with the most mitochondria is nervous tissue. The brain has approximately 10,000 mitochondria per cell. And so if you're damaging these 10,000 mitochondria in your nervous tissue, then conduction slows down, function slows down, and you feel like a wreck. You don't want to get out of bed, and your mood is affected, and you don't feel like you have energy to enjoy the day. And so, restoring mitochondrial health is a key component to treatment. And some of these remedies that I talked about, the glutathione, the IV vitamin C, the yucca, the NAC, sprouts, vitamin D, vitamin K, turmeric, resveratrol, probiotics, phosphatidylserine, phosphatidylcholine. There are no quick fixes. In fact, working with my cohort of patients, and I've seen hundreds and hundreds of patients with mycotoxin and mold toxicity. There are no quick fixes. It doesn't take weeks, it takes months to improve your health. And I always engage my patients in a 5 system detox. So, really encouraging liver detoxification, detoxification through meditation and deep breathing with the lungs, skin brushing. Skin is an excellent detox organ, making sure they're well hydrated so the kidneys are flushing out what it needs to do. And then, of course, the colon as well, making sure that we're having regular bowel movements. And I always include one or more of those binders. In addition to the mold toxicity, the long haul COVID patients also tend to become more sensitive to a couple of things that are in our common diet. And those are gluten and dairy. So, on my long haul COVID patients, on my patients suffering from mycotoxin and mold toxicity, I take them off of gluten and dairy, and they seem to be better off. Now, there are some functional lab tests that you can do, and they can test both for mycotoxins and antibodies against some of the more common molds that are growing in our houses and businesses. And I would encourage you, if you have long haul COVID, to get one of these tests done to see what kind of mycotoxins you're carrying around and to see how specific we can tweak the treatment to address your specific mycotoxin. They're both blood and urine tests. They're very accurate, and I run them on all of my long haul COVID patients. And then anyone that walks through the door that is suffering from the common symptoms that I would expect from mold toxicity, like an increase in allergies, fatigue, brain fog, immune dysfunction, and others. So I encourage all of you to switch over to our other website, the prolongcovidreset.com. And the rest of this journey about mycotoxins and mold toxicity, we will finish up on that other site. So I would encourage you to join us there in just a couple of minutes. Thanks.